Well, hello, everyone. I can't see everybody, unfortunately. And I won't be able to see when I'm presenting. So if you have questions, jot them down, and I'll hopefully have enough time to answer those questions. Um, I like to answer questions. Those are always good. So let me just quickly get into my PowerPoint, and we'll go ahead and get started. Is that okay, Elizabeth? Sounds good? Okay, perfect. Uh, Whoops. I have a couple screens here, so let me get things over. Whoops. Sorry about that. Everybody see that okay? Perfect. So my name's Greg Carter. I just a little history about me. Some of you may know who I am. You may have been to, I've presented before at our regional on the west side, as well as this. I guess I didn't present at the state, but I was at the state with a table. So you may have met me before. So this is kind of a similar presentation I've done before with some added content. So like I said, if you have questions, let me know, and I'll answer those when we end the presentation. So I am a instructor for Tacoma Community College in their respiratory care program. I've been a respiratory therapist for 30 plus years, not to give my age away. Probably 20 of those have been here at Tacoma Community College in the program. I'm also a state representative to our professional organization, which is the American Association for Respiratory Care. Been highly involved with not only respiratory therapy, but education and students. I do a lot of things with regards to students, mentoring them not only from a high school level, but also when they're in the program. This is my bread and butter. This is what I like to do. So I want to say again, thank you for having me present because I think this is a field uh, that a lot of people don't know about that I think is something that if people did, they would really, really enjoy. I wouldn't have done this for 30 plus years if I didn't enjoy it. And it's a great stepping stone into some of the things that you may be interested in, which I think is also a good thing. So with that, just because I'm used to presenting at our respiratory conferences, we always have to disclose our conflicts of interest. I have no perceived conflicts of interest. But like I said, I am the program chair or director for the Tacoma Community College program, but I'm really here representing respiratory and the Respiratory Care Society of Washington. I am their delegate. So like I said, I speak for all respiratory therapists to our parent organization when it comes to respiratory therapy, patient care. So I'm highly involved in my profession. And as I mentioned, also, I'm the co-chair of a task force called the Next Gen RT. And this kind of relates to HOSA, getting people interested in respiratory, starting early we start as early as the middle schools, going into the middle schools and talking to students about our profession because we think it's a wonderful profession that people can get involved in. So a couple of things I hope that you take away is that one, understand what respiratory therapy is, because many people, unless they have been contacted by a respiratory therapist, either because they have a respiratory issue or a parent or loved one has a respiratory issue, most people don't know that we even exist. So we're trying to get the word out to learn about the need for respiratory. There's like anything else in healthcare right now, there is a huge need in all of our medical providers, especially respiratory therapists. In fact, respiratory therapists is in the top 10 when it comes to healthcare fields that are growing and the need is there. So for those who are in middle school as well as high school, you're hitting it about right for jobs when you graduate and just about anywhere you wanted to go. And those jobs have usually incentives, tuition reimbursement. If you want to go on and get your bachelor's, master's degrees, they'll pay for that. There's a lot of hospitals that are associated with colleges, things like Loma Linda in California, There's Stanford that will hire you and then pay to help advance your education, which I think is a phenomenal thing. That's not something you normally see unless there is a need for the profession. And then talk about, what are some of the resources out there for you? As you may or may not know, this is our first year for Washington HOSA to have a respiratory competition, which is great. We will be learning together because the state of Washington, the respiratory therapists in the state of Washington have never done this before. So we're taking a lot of advice from our colleagues across the country and our parent organization. So this should be an exciting event come Spokane about the competition and how that will go and how it will grow, I hope, as years come by. So what is a respiratory therapist? Well, a respiratory therapist is a field. A lot of people think it's really specialized, and it is in a sense. Anything to do with cardiopulmonary respiratory care. The heart and lungs work together. And so when there's issues going on with either the heart or the lungs, a respiratory therapist is usually involved. And so that can be anything from, little kids, little babies. We're there from birth to death because respiratory, let's face it, everybody needs to breathe. Breathing, I think, is important. I think we'd all agree with that. And so respiratory therapists help people breathe, in a sense, to keep it simple. Talk about the specialty, and sometimes that may turn people away because they think you're kind of siloed within the profession, and that's not normally the case. These are some of the areas that if you were a respiratory therapist, you can branch off into. For those, hospital work is not for them. They may want to take care of patients who are elderly or who are looking to rehab themselves. So long-term care, obviously there's people who are breathing in long-term care facilities. So respiratory therapists is needed there. A lot of people like neonatal and pediatrics. That's something that I wanted to do when I was graduating, but unfortunately, if you've met me, I'm pretty tall. I'm very hard to miss. And little babies that I can put in the palm of my hand and my large hands and their small equipment, we're not a match. As much as I love kids and I love working with babies, it just doesn't work out logistically for me. For those who want to be in more of the critical care environment and want to get their hands dirty and see emergencies and be exposed to that, there's surface and air transport. So you can fly in helicopters, you can fly in fixed wings. Our air transport here in the state of Washington, working with Harborview Medical Center, which is a regional trauma center, they take patients from 5 different states because it's a region. So Alaska, Oregon, Wyoming, Montana, and Idaho, of course, Washington, I think that's 5. So that's an opportunity. Pulmonary rehab, it's one of the biggest things kind of up and coming right now in our field. That's how essentially I originally got into the field. Is I had an exercise physiology degree and I was working with patients who were doing cardiac rehab, and found what I really wanted to do was work in acute care centers doing that type of a thing, and found out that was respiratory therapists. And so that's how it kind of got me started into respiratory therapy initially. And then of course went to Harborview because I just liked working with trauma patients. If you're interested in sleep medicine, there's polysomnography for people who have obstructive sleep apnea or central sleep apnea. Education, obviously, that's where I'm at now in my career. Critical care, so working in intensive care units, working with breathing machines. There's even case management because now they're realizing I don't know why it's taking us this long, but we're trying to be more preventative in healthcare versus more of a reactive. So taking care of patients who have chronic lung disease, educating them about their disease so they don't come to see us in the hospital. And of course, home care. There's diagnostics, which is also kind of into the realm of exercise physiology. That's something else I wanted to do, testing lung volumes. There's management if you want to do it, industry, research. I mean, you can go on and on and on. And I think sometimes some of the acute care hospitals have these different areas. And I think that's what makes respiratory therapists unique. And that's one of the things that I fell in love with regards to respiratory, because I wasn't in one particular area of a hospital. I moved around everywhere. I was in the emergency room, I was in the ICUs, I was in the floors, I was doing diagnostics. So it gave me a little bit of variety versus just always being stuck on one particular floor. The one thing that's good about that or great about that now is that if you're thinking about being a, let's say, a physician assistant, you need patient care. Respiratory therapists are highly regarded for that physician assistant type of a role because we are highly exposed to these different areas and kind of have a knowledge base. It's not like we're actively learning and going to class about all these different areas. We kind of learn on the job and have this pretty good unique skill of these different areas, which is very good if you want to go on to be a PA. And another thing that I'll speak a little bit about later is respiratory therapists has expanded their credentials to come up with a mid-level provider like a physician assistant, but it's going to be a specialty area in respiratory. So it's called the advanced practitioner respiratory therapist function at the level of a PA. So you wouldn't even have to leave the profession to have that same kind of autonomy as a PA would. So without showing any kind of disgusting and nasty pictures or gross pictures, don't want to gross anybody out. What's kind of a day in the life of a respiratory therapist? A lot of assessing. We are considered physician extenders. As you kind of get to my age, you realize some of those specialty medical providers, pulmonology being one of them, the numbers are kind of dwindling, which is essentially kind of scary. So we are considered physician extenders. So when that pulmonologist can't be in the hospital, they're relying on respiratory therapists to be able to assess and treat their patients, which is kind of a nice thing if you like that autonomy and being a part of the group to make decisions about patient care. Because of that, you have to have very good assessment skills, learn how to interview patients, learn how to kind of get the information from them about what's going on with their respiratory health, doing physical exams with patients. We also consult with physicians, obviously. We make recommendations to what they should be doing. I think that was one of the hardest areas for me to get a hold of because we always kind of hold physicians at a high regard. But really, you have to look at them at the I and I level to be able to make these decisions and understand they're looking to you as the professional in this area. We are the only ones who specialize in respiratory for 2 to 3 years. And so we know the equipment, we know the therapies. So they really do look to our recommendations, which is it's kind of nice. A lot of different diagnostic skills. We draw blood. Sometimes that's scary for people with needles. We manage ventilators or breathing machines, as you may know them as. We maintain airways, which may seem scary because we are the ones responsible for a lot of our patients and how they breathe and keeping them breathing. That's really kind of the challenge of this job. It's one of the things I like to do because it's not always the same for every patient. And of course, responding to emergencies. If you've had CPR, you know it's circulation, airway, and breathing, or airway, breathing, circulation, as us therapists like to still consider it. That's our job. We maintain patent airways. We provide airways for patients. We help people breathe. We keep the lungs healthy. We keep them clean and clear. And we have lots of therapies to do that. And of course, we make sure the heart is circulating and doing what it needs to do so it can ventilate and oxygenate our tissues. And education is something big. Like I said, we're being proactive in patients and about their care. And part of that involves educating patients about their disease processes, how to take care of themselves so they don't end up in the emergency rooms all the time. I kind of think of respiratory therapists. Yes, it's healthcare. It's taking care of patients with cardiopulmonary disease, but you're kind of getting a feel that it may be a kind of a jack of all trades, where we're an educator. I say we're plumbers because there's lots of circuits that we have to deal with. We're salespeople because we have to sell our treatments not only to physicians but to patients. So we really have a kind of a multitask career, again, making it very, very interesting. So if you don't know, I know for sure because I'm getting up in that age. We're essentially America's graying, and what they mean by that is people are living longer. The average age is getting older, and with people getting older, there's a lot of chronic lung disease, just because our organs eventually fail and they get old. And so one of the things that we see is chronic obstructive pulmonary disease, which is an umbrella term for many diseases like emphysema, chronic bronchitis, and with that, it's the fourth leading cause of death. And so we deal and work with a lot of patients who have COPD. One of the risk factors of that is smoking. We're seeing a smoking decline, which is great, but instead of smoking, we're seeing a lot of vaping. And that has also some severity to it. It has impact on the lungs. So those are a couple of things that's going to institute or initiate a different kind of subset of chronic lung disease as we're seeing. I don't know if you hear the term popcorn lung, but that's something that we see with vaping in patients. And then, of course, there's asthma patients. Lots of allergens out there and occupational exposures that are leading people to asthma. And so we deal a lot with asthma. So those are kind of some of the major chronic lung diseases that we're dealing with on a day-to-day basis, outside of assisting patients breathing with ventilators. Now, most people know us from the 2020 and on. Most people, if prior to 2020, probably didn't, again, know what respiratory therapist was or that we existed. Well, what happened in 2020? We like to forget, but we can't forget, and it's still with us, unfortunately. We have COVID-19, the pandemic. And that's kind of when the word got out about respiratory therapists. We were on, all the different news channels across the country. We were on talk shows because we were a first-line provider, us nurses and physicians dealing with the COVID pandemic. So, I always like to kind of bring this one up is that we play a very vital role in patients because, like I said, breathing is important and we are the specialty when it comes to breathing. And so, we work side by side with those nurses. We work side by side with those physicians dealing with patients who have breathing issues. So we spend a lot of time in patients' room, gowned up, working with these COVID patients. And so I think if you were to ask a lot of the ICU nurses who is their kind of right hand or left hand, depending on how you want to look at it, most of them are going to tell you it's their respiratory therapist, just because it's one less thing that nursing has to deal with. They have a lot to deal with. So respiratory therapists are kind of a vital role in patients, especially in the ICU or the intensive care units. So that's a little bit about respiratory and what we do. A couple of things to think about just to kind of show off a little bit about the profession. Our roles are constantly expanding. There's a lot of credentials you can earn. RRT, you could be a pulmonary function technologist, adult critical care specialty, neonatal pediatric specialty, and as I have here, the APRT, which is that advanced practitioner respiratory therapist that functions at that mid-level provider. There's only two programs. One is currently the Ohio State University, and I believe the other one's going to be Rush. I'm not sure. We're still working on a credential and for that program. And there's just a lot of kind of political steps that you have to do before you can have or offer a credential. And we're in that process currently. We actually have people working at this level at a kind of an uncredentialed, uh, I guess I'm not sure what to say there, but they're uncredentialed, but they have the training to do it. We're expanding degrees. Respiratory used to, believe it or not, about 30, 40 years, I guess about 40 years ago, was a on-the-job training. And then it was a 1-year degree. And then it was a 2-year degree. Now we have 4-year degrees, degrees, and now this APRT training. I kind of see us as we're following in the footsteps as physical therapy, because physical therapy was very, very similar to that, where it was a 4-year degree, then it was a master's, now it's a doctorate degree. So expanding need. And because of that, that's why you start to see these credentials and you start to see this extra role from a respiratory therapist. You know, many years ago, we did nothing but take oxygen tanks to patients' rooms. Now we're working and dealing with breathing machines and kind of being a physician extender, which is kind of neat. So it's a growing field, I guess the bottom line is. Something to think about if you're interested in respiratory, and a lot of this is true with being in a medical field and, you know, speaking to HOSA students, you're probably checking many of these boxes because you want to make a difference in somebody's life. You want to have a high-tech career, something that's exciting. You're a people-oriented position. And so, you know, this slide's kind of redundant to the audience I'm speaking to, because you probably wouldn't be involved in HOSA if you didn't want a medical career or had some of these traits. And of course, good job salary, right? Which brings me to the big question, Greg, how much can I make as a respiratory therapist? Well, a lot of it depends on where you work. You can work side by side with another hospital and the salaries would be completely different. Some hospitals they have unions. Some hospitals have different differentials. It really kind of depends. But an average respiratory therapist in the state of Washington, it's about $82,000 a year on average. Now, that doesn't mean that you're going to make that much when you first graduate, but that's an average respiratory therapist salary. I would say that's not bad for a 2 to 3 year degree. And of course, the longer you work or the more you work, the more money you get. The thing about respiratory is typically full-time is doing 3 12-hour shifts, which leaves you 4 extra days if you want to work more or want to work overtime. So you can see there's opportunities to make some money with regards to being a respiratory therapist. So yeah, I did a presentation. I do some presentations down here at one of the local high schools. And one of the teachers says, I wish I would have known that about 15 years ago. So why do we need respiratory therapists? Well, it's been a perfect storm, essentially what's happened. And this is kind of true with really all of the healthcare fields. You know, with regards to healthcare, if you're as old as I am, and I'm not that old, you know a lot of these kind of ebb and flow with regards to the program. These careers get oversaturated, so there's not as many students. And when there's not as many students, that means we're not producing enough to keep the careers full. And that's essentially one of the things that's happened. So it kind of up and down is something that we've seen. We've seen a lot of decrease in enrollment, a 27 decrease in the last 14, 15 years in our programs across the country. Some of that has to do with people like me who are getting ready to retire out of our you know, my role as an educator. A role as an educator takes a higher level of credentials, like a master's degree or a doctorate degree. And there's not a lot of therapists that have those degrees. So that's one issue. Some of the programs are closing because there's not a lot of students. And when a program closes, that's less opportunity. The state of Washington, I just did this look a couple days ago for a project that I'm working on, is that we are only at about a 70% capacity with the 5 programs that are in the state. So, you know, one of the things I've seen with students is they want nursing, and there's nothing wrong with nurses. I love working side by side nurses, and it's a very important and a very exciting career. But what happens when you can't get in? and you can't get in. I have talked to many students who, it's taken 2, 3, 4 years, and it's like, I gotta get on with life. And I always suggest, why not respiratory therapy? You're doing hands-on patient care, and it's a great, like I said, a great stepping stone maybe into another career that you want to do, like nursing. And working 2 to 3 days a week leaves you lots of opportunity to go back to school and advance your education. So there's usually seats available, and it's not that people don't want to do respiratory therapy. And I think when people see this, that's what first comes into their head. It really comes down to people don't know what we do or that we even exist. And then retirements. Retirements are outpacing what we can provide. And it's estimated that we're going to have to train 155,000 respiratory therapists just to keep up with the therapists that are going to retire in the next 4 or 5 years. That doesn't include the need that we see right now for respiratory therapists. So it kind of speaks to the amount of jobs that are going to be available in the next 5 to 6 years, if not longer. And so we see, depending on what resource you're looking at, if you're looking at job growth or career growth for our profession, it's dependent on the resource that you're looking at. Anywhere from about 15 to 20% is what we typically see for projected RT growth. So take that for what you will. But thinking about graying of America and kind of some of these statistics, it's an up and coming growing field and expanding field, which I think is also nice. So how do you become a respiratory therapist? Pretty easy. I'll give you some resources that you can look up. There's a couple great campaigns going on right now that are sponsored by some of our bigger players like the American Association for Respiratory Care, our credentialing body, which is the National Board for Respiratory Care. BeAnRT.org has a lot of resources for students who are interested in respiratory. There's moreRTs.com that has some great resources as well. But essentially, you get into a program, get your degree, earn your credential, and then get licensed and find yourself a job. Credentials can differentiate as far as what's the entry level for each state. Our state requires a RRT credential. Some states require a CRT credential. All of the programs in the state of Washington, you're eligible to take those credentialing exams. CRT is kind of the entry level, where RRT is the advanced level. I always kind of, to give people an idea, it's like an LPN versus an RN. Where are the programs? Well, we have 5 programs in our state, 4 on the west side, 1 on the east side. Mostly are in the I-5 corridor. So up north in Seattle, we got Seattle College, and then Highline in Des Moines, us here in Tacoma, for me. There's Pima in Renton, and then of course Spokane in Spokane. Coming sometime in 25, 26, we will have Columbia Basin College in kind of the Tri-City area. They're going through an application right now. And so it should be no later than 2026 that they're up and running with their first cohort. It could be as soon as 2025. It really depends on how quickly the State Board for Community Colleges approve their application to start a program. And it's just not the state college board that needs to approve it. The accreditation board also needs to approve it. So that can take some time just because they don't meet all the time. They usually meet only a couple times a year, but they're well on their way. So I would expect no later than 2026 for Columbia Basin if you're in that Tri-City area. So we are a evidence-based, science-focused field. So if you're thinking about respiratory, and this would be, a lot of you are probably doing this anyways because you're preparing for a health occupation field. And we require usually very, very similar type classes. So you're looking at a lot of your STEM type classes, whether it's chemistry, anatomy and physiology, microbiology, math usually is for statistics. We're evidence-based, so we like you to be able to interpret statistics, p-values and all that great stuff. Communication is also important. Being able to communicate with family members and physicians. And it's just not verbal communication. I'd say most of my students that come to me that may have communication issues, it's nonverbal communication, how you hold yourself. Obviously, if you take care of a patient, something is kind of going south on them. We got to prevent not having the big eyes and the shock look, the deer in the headlight look, as I say. So you have to be able to kind of know how to present with, as well as communicate verbally. And then compassionate care. Like I said, you're probably not here if you weren't a compassionate person wanting to make a difference in somebody's life. And critical thinking. Probably the one issue for my students is critical thinking. It's just not how we're bred and how we're probably K through 12, how we're brought up through the system. We see a lot of our classes normally in those early ages of our education career being more facts, yes, no type of an answer. A lot of my students say, Greg, just tell me the answer. And a lot of times I have to say, it depends. Everybody reacts differently. Every situation's differently. You have to use the information that you have and do the best you can with making a critical decision with regards to a patient. And when somebody's life is in your hands, that can be a difficult thing to have confidence in your abilities to do that. So what are we doing as a profession? Our profession has put forth tools for people like me who are respiratory therapists in my role, even those therapists that are in bedside duties or in roles for working with patients in the bedside. HOSA is new to us. I think we've only really been involved for the past 3 years, maybe, if I'm lucky. 2022, 2023 was our first competition. So we haven't been involved with HOSA for very long. So we're still kind of finding out what HOSA is about and what we can offer HOSA and the students. So our professional organization is giving us a lot of tools and toolkits, and working with, our two national organizations are working together to get this job done and to let students know that there's some other exciting careers out there that they can take. And then to help us as respiratory therapists feel some of our need in our hospitals, because we desperately need to hire new respiratory therapists. And so, I'm doing a lot of volunteering. I go out to high schools and speak to not only HOSA programs, but some of the CTE programs that our high schools are offering. And if you are a student or advisor listening to this, I'll give you my contact information. And if I can't do it, I know I'm in contact and know all of the program directors in these programs, and I can link you up with a contact in those programs. And I know they would be more than happy to go out and speak to not only chapters, but these high school programs that are, health career type programs in the high schools. And hopefully serving as competition of judges. This is something I want to do and exciting for me. So who knows, I may be judging some of your events if you're going to be involved. That'll be kind of fun. Elizabeth's laughing. I can see she's like, you know what you're getting yourself into. So, when it comes to partnerships with us, I know, like I said, we've worked a lot with HOSA. I haven't personally, other than with Elizabeth in the state of Washington, but our parent national organizations are working together. And then they're helping us, my ARC, the American Association for Respiratory Care, they're working with my local state affiliate, the Respiratory Care Society of Washington, to give us tools to go out to these conferences. So we know what we're kind of getting ourselves into. They're giving us brochures, rack cards, posters, which is really, really nice. And they're the ones who, like I said, they're the ones who designed these competitions. And our first competition was in 2023. And of course, I'm looking out and getting their advice to say, hey, Washington's doing our first one this year, what to expect. So like I said, I'm excited about it. I'm excited to see it. If I'm not a judge, I'm going to be for sure watching and learning as well. So if you're interested in these competitions, and it sounds like there's some people who have signed up to do the competition, I will share with you a couple QR codes And I know Elizabeth is recording this for people who to kind of look back on, and you should be able to get to those QR codes, as well as websites. Our parent organization, the AARC, they have a landing site for HOSA activities for all players, advisors for HOSA, the students, for people like me, the RTs, as well as any of the AARC affiliates and program directors. I didn't even know what HOSA was, and I saw this, and I pulled a lot of stuff off of these toolkits to take to the high schools. And then obviously I found out about HOSA, and now that's kind of why I'm here. So I left an email here, marketing@aarc.org, or I would just encourage you at the very end, I'll have my email, to jot my email down. And by all means, please email me if you have any questions about how to get information or to hook you up with a respiratory mentor. That's really kind of my goal with doing this webinar and doing and attending the different conferences, both on the West Side as well as the state conference. And if I have any people listening from the East Side, I know Tony at Spokane College, and I can get you hooked up with Tony. And I know she has participated in the Eastern Side conferences, so I'll make sure I can make that connection for you. Here's some of the listings. Like I said, it's being recorded. I don't want to just hold on here because I know I don't want to keep all of your guys' time. I know time is precious. But bnrt.org and morerts.org. These are two, maybe, yeah, I think it's org, maybe com, sorry. This is in collaboration with some of the respiratory organizations that put a lot of money forth with resources. Then, of course, we have the AARC, which I'll give you the QR code. If you don't have time, it's the aarc.org. All you have to do, there's a tab for specifically for students. You click that tab and it takes you to all sorts of resources. The Respiratory Care Society of Washington, we're rebuilding our website, but it does have contact information from a lot of our board members who can get you in contact with me or somebody else like an educator. In fact, I would say a lot of our board members are educators, so you're probably contacting the right person. One of the things our organization's doing is we have designed a HOSA committee to plan some of our events for some of these HOSA conferences, for webinars, for just the show and tells at some of the local high schools. So watch for that. And of course, Commission for Respiratory Care, what we call COARC. If you want contact information from one of those schools, again, you can contact me and I'll share that with you. I won't hold it against you, even if it's not a TCC student or a TCC program. The Commission for Respiratory Care, they also have a tab for students that you can search all sorts of different programs. If you wanted to leave state, they're all over the country. Some of them are bachelor programs, some of them are master programs. And that's the best way. You can even look up to see what their test scores are like, what their job. So you can do some research and find a program that is good for you. All right, competitions. Elizabeth, make sure you stop me if I say something wrong. Like I said, I am still learning. I was just telling a colleague 10, 15 minutes before this started, is like, well, if I can read the competition and how to do the competition, I can lead you to that. And of course you can read and we can learn together. Like I said, this was in collaboration with a lot of big players with regards to HOSA and a lot of educators with regards to the American Association for Respiratory Care. So these are vetted. They're simple. And we had a goal in mind when it came to these competitions, and I'll kind of speak to this a little bit. It's a two-stage competition, and I'll tell you why. But initially, we wanted to start small. We realized a lot of the equipment that we use is very, very expensive. So we wanted to start small so the high school chapters can purchase some of the equipment or even share the equipment. Because there's some overlap between some of the other professions like EMT, paramedic, nursing, etc. They're all doable. And some of them you've probably done in some of your classes. Some of you've done in maybe a CPR class that you may have had. So they're all doable. It's not hard. Um, Very supportive network. Like I said, I'm more than willing to help you out. And I would encourage you to, even if you're doing something like this or want to do something like this, reach out to a college. They may be able to provide you some of the equipment to borrow to practice. They may invite you to campus and you can see some of the stuff and practice with some of their students. I always like students to come to my campus because they can really see some of the equipment that we use and they can touch it, they can play with it. It's a unique design because, well, I'll hold off on that. I'll get to that in here in a minute. But we plan to expand it. Who knows where this goes? This is the exciting thing about doing this. We hope to expand it to some point to where you're doing some of the funner stuff, what I call the funner stuff, the high tech stuff. So stay tuned for that. Like I said, we got to learn each other. We got to learn about your competitions. We got to learn how we fit into that. And so that's kind of what we're doing these first couple years. So here's those resources and the two QR codes here I have. The one on the left, the AARC HOSA information, that will take you to the AARC website. You may have to put in student HOSA in the search engine to get to this particular page. And then, of course, you can search respiratory therapy or respiratory therapy competition on the HOSA website, and it will pull up all of the information you need. There's directions, there's examples, there's links. They've really done a fine job. If I can figure out how to do it, I'm sure you can, because that's how I got a lot of this information. Is I went directly to those sites, talked to a few of my colleagues across the country, and figured out how to do this. And so they've made it pretty easy. There's videos on how to do this stuff. So if you're unsure, watch the videos, follow the rubrics that are provided, and practice, and you will do fine. It should be a good time. And this is what I'm talking about. You know, the HOSA website, you may have to kind of scroll down because of the different competitions and the different things that they provide, but you'll see health professional events. We're down in the lower left-hand corner. You can see respiratory. This is not an active site. This is just a picture of their sites. And then on the far right, you see respiratory therapy. You kind of see the beginning stages of the documents that they have provided you and the directions that they've provided you. Like I said, it's a step-by-step process. And once again, any questions, reach out to either me or reach out to some of these resources and they can hook you up with some information or at least get you some help that you need. And so here's just in a picture of that AARC website. It's a HOSA student resources. There's some information there for people like me. There's some information for your advisors and obviously students. Here's just a couple examples of some of the videos they have that they've provided you. And again, stop, play, watch, and you can get the job done. So round one, we wanted to do something different. We didn't want to do just a skill. We wanted students to understand what respiratory therapists are and do. And that's where we got round one. And it's an opportunity for you to research what respiratory therapists do, what we are, and not only to find that information, but we're a medical provider that is based off of evidence-based medicine. So part of that job is doing research and looking for things, looking for information. So we're kind of doing two things, even though it's round one and it's one thing that you're doing. So think of it, you know, one of the things we want to see is that you interview a respiratory therapist. Like I said, may not know any. I can help you find respiratory therapists to interview. So you're basically asking, how does a respiratory therapist play a role with blank? And choose one of these three things: asthma management, COPD disease management, or smoking and vaping cessation, right? So conduct an interview. How you conduct the interview doesn't really matter. You can meet in person, you can do Zoom, you can do phone calls, do whatever easiest for you and the respiratory therapist. the questions. It's really up to you kind of what your topic is. So this is like an 8-minute presentation, and I believe these are going to be done online. Elizabeth, shake your head. Yes, no?
In Washington, students will submit their video recording of that interview
There you
and
go.
that round one component to the digital upload system. It's only for Washington though. So
Okay, right. I was gonna
we're
say,
being the special child.
like we're saying, we're trying to figure out and how to fit it in the time frame. Washington is a fairly large group of HOSA students, so that's one of the tougher logistical things that we have to try to fit you in. I know some people do poster boards and presentations in person. So like I said, I'm still learning as we go, and I think Elizabeth is too, and how we're going to do this, but we'll figure it out. And again, we're going to have fun doing it. So connect with an ART, a respiratory therapist. And like I said, there's lots of materials that you and resources for you to be able to do this. So 8 minutes. The one thing I would say that I'm hearing from other states that have done this is practice, practice, practice. Practice your presentation, practice your skills. This is probably something you can't do at last minute. This is a little bit of a preparation. One, trying to find a respiratory therapist, decide what you're going to do, a little bit of research. 8 minutes, not a lot of time to do what you're doing. So keep kind of that in mind. Use the tools and the rubrics that are provided to you on the websites, and you should do fine. Round two. So round two involves some type of skill. These are all basic skills. This is what I would say basic floor therapy for me. Airway management. You probably, if you've taken CPR, you've done a lot of the airway management things. Donning and doffing, or donning and removing, if you will, transmission-based isolation garments. I know some of the programs that I go talk to for some of the CTE high school programs, they do this already. This is something that they learn. Some of them get certificates for learning how to do their infection control. Administering oxygen. Again, if you have nursing programs, it may be something that you do in some of your CNA programs. Obviously, EMS or paramedic, they do this. So you may have some of the equipment. Nasal cannulas are pretty easy to get. Probably the most expensive equipment really in any of this is going to be a pulse oximeter, and it's not extremely expensive to buy a pulse oximeter. Assessment of the newborn, knowing what APGAR scores are, when to do them, how to do them, pretty easy. Same thing with vital signs. And then handheld nebulizers. We give a lot of breathing treatments with medications directly to the lungs. It's an effective way to do that. So again, pretty simple to get all of this equipment so you can practice your skills. So just a couple of things to think about with round two. Again, starting basic, look for local connections. Like I said, look for is there any programs in your area that are willing to share some of the resources with you? Are there hospitals willing to share some of the resources with you? Calling a respiratory department manager and saying, can we have a couple of your small volume nebs? I'm sure they're going to be able to provide those for you. Or, isolation garments or any of this equipment. They're probably not going to give you a pulse oximeter, but they'll give you some of the disposable equipment. If they give it to me, I know they'll give it to high schools, especially if you're interested in our field, I'm sure. A lot of videos. Again, the whole idea of doing this is not only that you learn about this great profession and what we do, but it's also making the connections and mentoring you through the process. It's something that we like to do. All you have to do is reach out and ask. And that's all really that we ask that you do, is just reach out and ask. We can't read your mind. And if you need help, ask, and we'll provide the resources. And I think that is it. I'm under an hour, so that was good. There's my email, gcarter@Tacoma Community College. So I think I could take questions if there's any questions, Elizabeth.